Welcome to Speaking of Pets, Take 2.
This week, we are revisiting a previous episode.
Lots of great information. We wanted you to enjoy it twice.
Here's today's episode, created just for you and your pets.
Hey, Janet, you'll never guess who's on the show today.
Tell me.
Dr. Rance Gamblin with, you'll love his accent. And I'm not going to tell you where he's from because I'm going to make you guess. So first of all, Rance got his undergrad BS in biology from Mississippi State, so I'm kind of giving it away. Internship at Colorado State. I don't know why he got out of the South. But then he is a Buckeye. Residency in internal medicine at The Ohio State University. And I hate to do this to you, Rance, but he's been at my favorite veterinary hospital, Metropolitan Veterinary Hospital. He's been the veterinary oncologist there for 24 years. I can't believe it. I'll tell you, when you hear the word cancer, you literally freak out. And I can't imagine having a more calm person to have to deal with your pet than Dr. Gamblin, because I'm OCD and he's like the Antichrist of me. And it's just nice to have that calming effect and to go over with you, okay, these are my options. I want to ask Rance, especially the big difference in human oncology, their goal versus veterinary, because so many clients of mine will say, I'm not putting him through that. So Rance, welcome to the show, and please go over that. Please go over the goals that we have in veterinary medicine and how that differs.
Sure. Number one, thank you guys for having me. And not to correct you, but just a little bit. I did not do an internal medicine residency. I actually did an oncology residency.
Oops, I see that now. Oncology, hematology. Yes.
Right, yes. Because I was Guillermo's resident, who was definitely an internist and closet hematologist. So, but no, you're absolutely right. We do have very different goals, I think. And as much as I hate to say it, I really think that there's a lot more emphasis on quality of life issues on the veterinary side than maybe, unfortunately, that there isn't on the human side a lot of times. They push us really, really hard to cure us, and I think on the human side rather. And so there is a lot of significant dose intensity and aggressiveness of therapy that I don't think that we maybe practice as much on the veterinary side. I think our goals are a lot more, making sure that we do the very best that we can to control the disease as well as possible, as long as possible, but trying to maintain as normal or near normal quality of life as possible.
It's interesting that you say that, because I was just talking to someone the other day that told me she had lost her husband, that he had cancer and the chemo, quote unquote, killed him. And I saw a study in human medicine, they're just starting it now, of, hey, why don't we try lower doses and see if we get the same results without the complications that these poor human patients are seeing. And I thought, that's what we've been doing forever in veterinary medicine.
More or less, yeah.
Well, I think that's why pet owners are hesitant, because you see what happens to your friends, to humans, what they go through. And, Daddy had cancer for 10 years, and it was hell. And they don't want to see their pet go through that, especially because the pet can't express themselves, right?
Well, Daddy's cancer, though, he was in a trial program at UH for 3 years when the cancer went to his liver. And he and I discussed it. And he said, Al, what do you think I should do? And I said, listen, Dad, here's what I think we ought to do. Let's start it. And if for 1 minute you are uncomfortable, we're done with it. And I'll tell you, the most he ever had was he had an ulceration of his oral mucous membranes. And that was it. And, did it really help him? I don't know. It was in a trial where they kept increasing the dose with each patient. But, yeah.
Well, and he told me, it's interesting. He told me because, his best friend, Uncle Frank, had lung cancer and it was horrible and all that. And he said, I'll never do it. Our dad said that. And then he told me he decided to try it because he said, if I could help one person, after me.
I didn't know that. Oh.
Yeah, he told me that. And I thought, that's really respectable and kind. So anyway, I think that's one reason humans don't want to have their pets go through chemo or whatever it is, because
go
of that.
through that.
I know.
Yeah.
I know.
So how do you talk to people about that, Rance?
Well, as you might imagine, that is one of the questions that comes up as soon as we start talking about medical therapy options. As far as chemotherapy, et cetera, is concerned, that's everybody's major concern is about side effects, and I certainly don't downplay that that we see side effects, because we certainly do. But I will say that the frequency and the severity of what I tend to deal with is probably not nearly as dramatic as what they tend to deal with on the human side. And quite honestly, so much of it is I really think that our dose intensity is just so much lower than what gets used on the human side, primarily because of the side effect issues. Yeah, and it's kind of funny. I mean, whenever I go or listen to MD oncologists talk, and I start looking at their chemotherapy regimens and that type of thing, and knowing something about these drugs, quite honestly, I have no idea how they keep from killing us sometimes. It just, like looking at this stuff, it literally gives me pause. And then probably the same is oppositely true for them whenever they listen to maybe some of our talks, and they like look at what we're doing. They're like, "One, are you guys even doing anything?" Maybe, So it's, I would say maybe the answer lies somewhere in between. But I think we're always looking at ways to maybe optimize response, but minimize or at least live an acceptable level of complications.
So you must have to counsel patients, the human patient, the owner, when they hear the big C word, right?
That's a good half of my job, and I would say, and I would say that there's a big difference, I think, in the interaction that I have with the client that, say, maybe comes through the emergency service or comes through the internal medicine service, and they're diagnosed, and the diagnosis is really kind of fresh and raw, and walking in and talking with them, as opposed to, say, the one that's being referred to me by their veterinarian that they were diagnosed 2 weeks ago, and they've had a little bit of time to take a little time to read, digest the whole situation, and maybe come up with a list of questions, and maybe starting to get their head around, the diagnosis. I can, as you might imagine, I have a little bit more calm conversation with the second group than I do with the first. That first group sometimes can be, pretty on edge. That's for sure.
Do you find you have to correct a lot of misinformation?
To a certain extent, to a certain extent, in I think sometimes that is a byproduct that maybe they read or they have heard something and misinterpreted it. I also think that sometimes kind of like where they go looking for information, is a big factor. As we all know,
Dr. Google.
Internet search engines they're absolutely wonderful, but they may not necessarily always be your best source of information. And so I try to give people resources as far as good places to go look, and usually directing them to places like university websites, that type of thing, where that information has been pretty well vetted already.
I read a survey where they surveyed 70% of pet owners that went through chemotherapy with their pets said they would do it again. And I thought that was a wonderful high number. I was surprised.
So what are the most common types of cancers in well, I'm going to say in dogs?
Well, at least maybe the best way to approach it from my standpoint is, which ones do I see most commonly in my practice? Certainly from a medical treatment standpoint, I mean, lymphoma is probably the one that I deal with the most. We see a lot of what would be non-Hodgkin's lymphoma. On the human side, we see a lot of that in dogs as well as in cats. Certainly a lot of mast cell tumor cases, osteosarcoma, so bone cancer, hemangiosarcoma, which is a real common aggressive tumor that arises in the spleen and the liver and a wide variety of other places. And also a lot of soft tissue sarcomas as well, which just seem to be really common in older, and in some of our older patients. But quite honestly, I see a little bit of everything, quite honestly.
What's going on with this? I was reading about it. This researcher from Yale with osteosarcoma, with Dr. Mamula, I think his name is. That sounds fabulous.
Okay, wait,
Yeah,
for the folks at home, what's whatever?
osteosarcoma. Osteosarcoma is the most common type of primary bone cancer, or the
Okay.
tumor that arises within the bone
Okay.
itself. So that actually is a really common cancer that we deal with usually in large and giant breed dogs. But yeah, the Yale vaccine study is primarily looking at expression against the HER2 gene that is in osteosarcomas, in some anyway. It's a really kind of fascinating study. That I guess my biggest concern with that study has always been they're kind of taking all comers, it seems like. And whenever I started like looking at kind of their study design, I was like going, they're going to have a lot of data that I'm not sure how you're going to start to kind of ferret out all the information that is there. Quite honestly, but just because it doesn't seem like there's a lot of consistency, or at least a regimented placebo and active drug, treatment, that type of thing, as well as, they may be on other forms of treatment, and you're starting to try to separate out what's having what effect.
Wow.
So I think it's one of those things that may very well prove to be incredibly valuable. I just wonder how we're going to sort all that out on the front end.
Rance, you and I had a mutual patient. I can't think of the name right now, but it was a chow, and it was on the melanoma vaccine. It was a red chow.
Right.
Is that still with us? Do you recall?
If it is the dog that I am thinking of, I believe so. Or
it was an oral melanoma, I believe.
Okay. I'll be honest with you. I've got enough. Enough chows with melanoma that there's, and interestingly enough, several of them belong to the same owner. So I'm not sure if I'm remembering the right one, but yes, I'm treating several, and even if that particular dog isn't alive, I'm not certain that the dog that you're thinking of, I'm not certain it passed away from melanoma. I think it may have been from other causes.
And wasn't that a human melanoma vaccine that didn't work in humans? Go over that, because I'm confused.
Yeah, it actually is not it's not a human vaccine, but the way that vaccine works is it's actually a human DNA that codes for tyrosinase, and tyrosinase is found on the surface of melanoma cells, and actually should really make it stand out like a sore thumb. And what they've learned is that human tyrosinase is very, very, very structurally similar to canine tyrosinase, but there is enough of a difference that, if we were actually able to insert that human DNA into canine cells, have it start producing that human tyrosinase molecule, that we actually get cross-reactive antibodies against the canine molecule as well, and that kind of leads to a therapeutic benefit for those dogs.
So did those dogs have surgery first to remove the melanoma, and then you follow up with the vaccine?
Right. Yeah.
Okay.
It seems like it is most effective whenever you're dealing with minimal residual disease.
Okay.
So there actually was one little small study that looked at dogs who did not necessarily have complete microscopic excision, but they had all gross disease removed. They seemed to have some very similar survival times to those dogs who had complete microscopic excision. So yeah, it's primarily used in the post-operative setting. Yes.
Is there anything pet owners can do to help prevent these cancers, or are they genetic? Are they?
Well, what causes it is probably the question that I get asked the most, and just like it is with us, there isn't any one thing that's responsible for the development of cancer. It's going to be a combination of genetics and environment in just about every case. And as I explain it to people, I said it's a matter of lining the dominoes up in the right order. But the unfortunate thing is that sometimes you don't even know what the dominoes are. But
Wow.
Certainly there are a lot of breeds that, if I see a certain breed on my books, I almost would just kind of run a little bit of a game with myself and see if I can predict what I'm seeing them for. That type of thing. And more often than not, I'm right, type of thing, just because you just keep seeing the same things over and over. So there definitely seem to be some real genetic predispositions, but I don't know that genetics is necessarily all of the story. But we certainly see enough breeds that are, I would say, maybe uncommon enough, in the general population, that we see the same cancers over and over again in those kind of less common breeds. You're not going, that has to be a genetic event.
Like bladder cancer in Scotties.
Bladder cancer in Scotties would be one. The other one that I really think about is like the histiocytic diseases that we see in Bernese.
Yes.
Bernese mountain dogs and flat-coated retrievers and that type of thing. Golden retrievers and Labradors and all those guys. We certainly see more than enough oncology cases out of those guys, but there are also some of those common breeds in the United States. Those really uncommon breeds that we see with the same cancers over and over again, to me, are the ones that really smack of genetic predisposition for sure.
Is there anything, so if your pet is diagnosed with cancer and they're on chemo or whatever the treatment is there anything a pet owner can do to kind of, ease the pet? I don't know, how do I say, to
like
make it
a
a little more
supplement or
comfortable?
something, you mean, Jen?
Well, remember, like, Mother thought that the carrot juice.
Oh yeah,
Rance,
we were raised natural hygiene. My mother had an Acme juicer, and we were
we still have it. Penny has it.
I
Excellent.
have carrot juice every day. We were never vaccinated for anything. And then she fought. Janet was the baby, so then she had to fight with Janet to drink like a shot glass of carrot juice. So then she gave it all up.
To this day, I can't stand it.
Okay, whatever. Okay.
And she put celery and garlic and all this stuff
Not
in there.
garlic.
Sit down and
No.
go, you drink that damn thing. And I'm like, ooh.
No. It was what's the green thing that's
Kale?
No, kale wasn't fashionable then. Swiss chard. Oh my God.
Swiss chard. I love Swiss chard though, but
anyway.
But it would come in the juice, and then so she gave so much to my dad. He's lying there, his feet are like this, and the oncologist comes in and is like, well, Mr. Novotny, like, I notice and my mother goes, that's the carrot juice, the beta carotene, because she was giving him so much that the poor guy had orange palms and orange feet.
Oh my gosh.
So I'm just wondering,
insights into childhood trauma here.
Lots of it.
Lots.
That's awesome.
But is there anything like pet owners, maybe you've seen it done with pet owners in a more like holistic,
is there anything they shouldn't give them?
Yeah.
Well, I'll be honest. I get asked every day. I get the client who comes in with a bag full of supplements, and I'm quite honestly, a lot of times it's stuff I've never even heard of. Quite honestly, I do think we have to be careful with those, and because we know that there may be some things that may interfere with drug metabolism and all those types of things. For the longest time, everybody was really wanting to super supplement with antioxidants and vitamin E and and all kinds of other things. And quite honestly, you think about how do those drugs work, or those supplements work, basically by preventing free radical formation and trying to help DNA heal itself and all that type of thing. Well, unfortunately, that's kind of how a lot of your chemotherapy works, is by causing free radical DNA damage. And so, there actually has been some studies in women that were on high dose of vitamin E that were getting chemotherapy that actually had poorer survival times because we actually were interfering with their chemotherapy.
Wow.
So I always tell, generally anything, if any supplements that we are going to use, let's do them in moderation, and always, at least have a conversation with myself or with your veterinarian about, is there anything to indicate that there may be interferences with drugs that we're already using, et cetera. It's like anything else. The more we know about what we're actually giving these guys, probably the better off we're going to be.
Rance, I was reading, I think it was in Veterinary Product News, where Yunnan Bio, which some people use it in Humantrust, the one company they get it from in China, it was contaminated with something like a nectine or something I can't recall, it's like ANE something, which is deadly.
Nice.
So, yeah. So now I wouldn't even feel comfortable touching that stuff, or recommending
Yeah,
it?
and the other kind of interesting thing that came out of a lot of that, and I would have to go back and make sure that I had my facts completely right about this, so be careful about quoting me on it. But I know that
Okay.
one of the other real controversies about it was that one of the sources for it were pangolins, which pangolins are an endangered species.
That's right.
So it's kind of like that kind of gives me a little bit of pause right there.
Yeah.
So
Yeah.
So,
On the
so a
Facebook. Go
patient,
ahead.
so patients, my pet is diagnosed with cancer. What are the treatments? I have no idea. Is it oral? Is it a drip? Is it topical?
well, I always tell people our therapy options are not all that dissimilar from what would happen if it was you or I. So surgery, radiation, chemotherapy are all still kind of the backbones of management on the human side and on the veterinary side. But as far as on the chemotherapy side, the drugs that we use, there are very few true veterinary chemotherapy drugs. I mean, most of these are drugs that we're borrowing from human medicine. So some of them are oral. A lot of them are intravenously administered, etc. So a lot of the same precautions that we use in their handling on the human side, we use on the veterinary side as well. But it all depends on the disease and the drug that we're using, as far as what formulation, what frequency, that type of thing that we're using.
And then do the patients, the pets, do they have like hair loss and similar side effects as humans?
That actually is a really good question, and it's one that I get asked all the time. There are certainly breeds that their hair grows like ours does. Basically the guys that go to the groomers, right? The schnauzers and the poodles and those guys, their hair grows like ours does. I actually have a slide that's in my one of my chemotherapy talks of a completely hairless dog that I basically make people guess what it was. It was a dog from my residency. It was one of 5 dogs that I had that completely lost its hair in the course of my career.
Wow.
It actually is a Bichon, and let me tell you, a Bichon with no hair looks as much like a Jack Russell Terrier as anything you'll ever see, which is actually kind of funny in its own right. But those guys whose hair grows continuously, they are more at risk for hair loss. However, most of the time, usually what I get is just more like thinning hair coat type of thing. But just actual bald dogs, like I say, I've seen it happen 5 times in my career. The dogs that shed in and shed out coats, it's really rare for them to get, anything much more than just a little bit of hair coat thinning, accentuated shedding, that type of stuff. The one thing that I will see a fair amount of is that if you get hair coat thinning, some of these drugs also cause skin darkening. And so if you've got a light skinned dog and a light coated dog, and then their hair gets thin and their skin gets dark, it shines through the hair coat. And doxorubicin is notorious for that. And I can usually walk through the lobby and I can almost point to dogs, that I can tell that they've had doxorubicin. Now, one of the newer drugs that we've been using in lymphomas is a drug called Tenovia. And Tenovia actually does have some almost kind of more direct skin side effects. And generalized alopecia is one of them. And I've actually got an English bulldog right now that actually has dropped probably a good 50% of its hair because of it. I've got to believe that it's Tenovia because there's no other good reason for it. But yeah, there's every one of these drugs has got some peculiar side effect. But we certainly don't see the degree of hair loss and stuff that they see in people.
Interesting.
Janet, my Zoe had that little beagle mix I had. She had lymphoma, and she was treated at Metro, and she did well for 1.5 years. Yeah. And to explain to people how horrible it isn't, she used to trot in there, and of course, being a vet, they'd let me go back with her, and then I'd leave her, and we'd go grocery shopping and come back because she had her little IV infusion. But they're sitting on the floor with her. She's getting treats. Yeah. It was a very pleasant experience. I have to say, it looks to me much more pleasant than that chemo chair that I see on TV that people are sitting there And the person holding their hand, that lasts 2 seconds and they're on to the next patient because it's like a factory. But I have to say at Metro, I mean, or else I'd bring one, Cinnamon was coming in for her ultrasound and I'd say, oh, who's that? Oh, they're here for their chemo infusion. And they were having a great time. So I can't say enough about the loving care that all of my pets, and thank God only one had chemotherapy there, but that they received there. These techs and we love animals. That's why we're in this profession. And it's just so nice to see that your animal's lovingly taken care of.
Oh yeah, our techs are the best, no
They
doubt.
are.
Like I say, I can't say enough good about them. That's for certain. It's funny that you said that though, Alice. I actually treated a good friend of mine's dogs. He actually had 2 Goldens. Both of them ended up having cancer. And it was so funny whenever he'd bring them there for treatment. They knew where the treat jar was, in the room. And whenever techs would go out to get them out of the lobby to bring them back for treatment, they would literally pull them all the way up the hallway, run in and sit down next to the sink and stare at the treat jar until you started doling out the treats for them to get treated.
I think we try to attach sometimes our feelings and thoughts about something, and they're like, just give me the food. You know what I mean? They're not thinking about that.
When our Shaggy got cancer, that dog was getting chicken skin. We just
Now,
spoiled
wasn't that a mast cell, Janet, on the digit?
You tell me. It started popping up all over.
Okay, Rance, that dog, she lives in Connecticut, and she sent me a picture, and of course it was a big red nodule on the digit. So Janet takes it to her vet, and they were like, well, this is an unusual place for mast cell. I'm like, no. And so
it started back here.
Oh, okay, it did.
And they were saying, oh, it's not going to be cancer. And then the vet called me and said, I am really sorry, but yeah. And then it literally just started popping up like.
And what did Dr. Cotto say, Rance? Never trust a mast cell tumor.
That's one of the things that he said.
That's one of the things. That's right.
I've never seen anything like it.
Well, most of them usually started with, I may have neglected to tell you.
Yeah, that's right.
That was,
Dr. Cotto was a wonderful mentor.
I heard that for 3 years. Yeah.
Yeah, I bet you did. Yeah.
I may have neglected to
tell you.
Blue Buffalo Natural Veterinary Diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo Natural Veterinary Diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry. And I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
The other thing that I tell people on the Facebook page for the podcast is make sure you look in your pet's mouth. And, I can tell you a story about that. We had 2 office cats. One of them was from Memphis, okay, Rance.
Right.
And the
Big
other
Jerry,
one
Jerry.
was Jerry Harris's. Someone brought in a litter of kittens, and I said, oh, I'll get a friend for Big Jerry, was the cat from Memphis' name. And so I walked in the room, and this little gold cat just was the shyest thing. I said, better give me that one, because I knew it wasn't going to be a good family cat. Anyhow, 10 years later, we were feeding him, and I said to my technician, why is this canned food all over the place? Well, we looked, he had a tumor in his mouth.
Oh my God.
He's trying to eat, and the whole canned food's going all over. And you really couldn't touch him. He actually got more feral the longer we owned him. Yeah. So I gave him a sedative when we looked in there. But that's another reason people have to look in the dogs and cats' mouth. Because just like with melanomas, if you catch those early.
Yeah. Several important things there. Quite honestly, I do think one of the big triggers, that kind of tips people off, or at least should tip veterinarians off that you're dealing with a problem is suddenly we start getting like change in breath and that type of stuff. They start getting that bad breath that'll roll up wallpaper. Yeah, it could be bad dental disease. It sure could be, but that's not the only explanation. And in fact, I start to get more concerned about the possibility of underlying cancer if they've got bad breath and I can't find anything.
Oh, right.
Because it just seems like if you start to get changes just metabolically in general, that starts to impact things that bad breath and that type of stuff is one of the things that kind of comes about. But yes, to your point, so many, I think, of the oral tumors that we deal with, and at least one of the bigger publications that looked at sites of occurrence, it was like the fourth most common site in the body in dogs and cats, to actually be dealing with cancer is the oral cavity. So, if you're able to detect them whenever they're relatively small, your treatment options are significantly improved over whenever you start catching them, whenever they're gotten completely out of control. So in two, I mean, I think that's one of the challenges that we deal with a lot of times with, not so much in cats, but certainly in dogs, is that, when you say, well, it's only a 1 centimeter tumor. Well, a 1 centimeter tumor, in a Labrador and a 1 centimeter tumor in a Chihuahua is two very different things. A 1 centimeter tumor in any cat is pretty much the same thing. But the smaller you can find them and the easier you can deal with them, and hopefully be able to deal with them maybe more aggressively. If you've got, a more aggressive management on a smaller tumor may still leave a lot of functional, tissue in your mouth to be able to do the things that you need to do. So.
The other place that I find people don't look is the rectal area.
And,
because who wants to?
Well, because you should. Because, I remember it had an elderly gentleman brought in 2 cockers. And I said, oh, am I seeing 2 today? In great surprise, because I would have allowed longer time. And he said, no, I can't take this one without taking the other one. So after I looked at the patient that was scheduled, he said, the other one's been scooting. I said, put him up on the table. So I do a rectal on him. And Rance, my heart just sank because I knew it was a tumor. It was a tumor. And to be honest, that saved that dog's life. Just coming for the ride that day. And I think he went to you after that. And another story I can tell you, I was subbing when Hinckley Animal Hospital, their new owner, was in a horrible car accident. And so, they were calling around and I said, oh, put me down for 3 days a week. So the Shar-Pei comes in for its Cytopoint shot. And I said, no, to the text. Before you do that, let me look at this dog. And it had this big, draining area behind the left kneecap, behind the stifle. And I did cytology. It's a big old mast cell tumor. So that went over to you. And for the last I heard, was doing well. But what was mistaken as allergy, because no one checked a cytology of it, was really a tumor. So.
Right.
Yeah, but rectal
100%.
area,
Paget and I always laugh, when we're talking with interns, et cetera, that the only reasons to not do a rectal exam as part of your physical is if you don't have any fingers or if the dog does not have a butt. So because that's another one of those that small anal sac masses or something along those lines, that's a lot easier to deal with than whenever they're the size of a tennis ball, or bigger. As unfortunately I get involved with sometimes. So.
Well, that's where Shaggy started popping up, out his backside.
And that's the other reason, for dermatology and oncology, if there's a skin lump or bump, it needs a needle put into it. I don't care if it moves. I don't care if it's not red. I don't care if it has hair or not hair. We need to find out what that is. 9 out of 10 times, it's nothing to worry about. But if it keeps growing, then Dr. Paget takes it off, and then you see Rance for follow-up chemo, whereas if it was smaller, we could have taken it off with wide margins, and you would have never had to see Rance for chemo.
Right.
Yeah. I agree. I mean, number one, I admit I'm kind of a closet clinical pathologist anyway. I mean, I absolutely love doing cytology, so I do a
love
lot
it.
of it because I like it.
Mm.
But I also think that it's probably one of the most valuable things that you can learn to do, quite honestly.
Yeah.
I think you're kind of shortchanging yourself as a veterinarian if you don't learn how to do it. If for nothing else, I mean, one of the lectures that actually I give a cytology lecture to our interns at Metro every year. Number one on like how to collect your sample, and just basics of evaluating it, and basics of operating the microscope and all that type of stuff. And I always feel like if nothing else, I mean, there should never be a time whenever you get a cytology result back from your pathologist that says, inconclusive sample, because of poor quality. Even if you don't know how to read it, at least make sure that you're sending them something that's worth reading. Saves a lot of time, a lot of hassle with your client.
So Rance, once Alice was out here visiting, and there was something on the dog or the cat or something, and she goes, don't you have a microscope? I'm like, well, we have the boys, like the little metal toy one. And she's like, get it. And I'm like, okay. And then there's like, the play slides. And then
And
she said,
vegetable oil, because they didn't have any
no,
mineral
wait, you said a fixative or something. And no, I called the neighbor because we had no baby oil. It was baby oil.
Oh, yeah.
And so I'd run to the neighbor, get the baby oil, and I didn't even know what it turned up. There she was with that little toy one, but it worked.
Yeah.
Alice, I had like a little Gilcraft, came in a little metal box whenever I was a kid. So
Alice had, growing up, she had the one that opened like this. It was metal and had all those bottles in it. Do you remember?
Oh,
that?
yeah, the little chemistry set. There you go.
Yeah, you had that, Alice. I remember that.
Well, that was with my makeshift telescope because I wanted to be an astronomer.
Yeah, but you know what I had, Rance? I just got to tell you, I had the Barbie house that opened like this with multiple floors and full on like mid-century furniture.
Did your daughter have the Barbie house, Rance? I bet she did.
Actually, but neither one of my girls were big into Barbie.
Oh,
so
good.
Oh,
they had binoculars and that type of stuff, and they bird watched. Oh yeah. So
cool.
That was their big thing. So.
That's a thing on Sanibel.
Now I've got a horticulturist and a wildlife biologist.
Oh, cool. Where do they live?
Actually, one of my daughters lives back in Mississippi, and my youngest daughter lives in Alabama.
You're staying south. I know it. I know as soon as you retire, I can just see that car driving south.
Yeah, I was going to say my wife and I have been talking about it a lot. It's we've got 30 years of friends here, but we have no family left.
No, that's right. My sister moved to Germantown, which I'm so glad because the crime was getting so bad where she was in Memphis.
Sure.
So Janet and I helped her move, and we're still having PTSD from it. Right. Oh my God. Who needs 10 black turtlenecks on an 80-degree day in Memphis, Tennessee?
The answer is no. Yeah.
Who saves a box per child from preschool, okay, all the way through a doctorate, and they're now in their 40s?
Yeah. No, but I've got one.
In the third floor attic, Rance.
Okay,
in the third floor attic.
We came in 2 sessions. I was there with one of her daughters, with my niece first, and then Jan came back.
Smart.
So my sister Penny sits down in their lounge area, and she's sitting there, and I'm there with boxes waiting to put the stuff in the box after I've carried couches on my back. And she's going through hundreds of coloring books. And I said,
wait, and the daughters are in their 40s.
Yeah. And I'm like this, and I'm like, not to be judgmental, but what is it you're looking for in each of these books? Well, if they're colored in, then I won't donate them. And I just walked away because I knew what I was going to say. And then it gets better. Her realtor was Ruth, her neighbor up the street, again from the south.
No names.
Oh, well, not her last name. I don't know her last name. But my sister thought if she buys a house for the amount she's selling this house for, even Stephen, okay? So she ended up, of course, you have to pay the realtor and taxes and everything else. So, okay, this is what we were dealing with.
Wait, and the realtor sitting there going, carry the one.
Yeah, carry the one. Yeah, and Erin, my niece, who's like me, OCD, comes back and says, you won't believe this. And I'm like, don't even tell me. Because if I can't even tell you, Janet and I came home. When I came home, I said to Mike, I should have stayed longer, but I just couldn't do it.
We couldn't do it. We had like 48 hours on the ground. And then the other thing is I was the unpacker.
Yeah, I was the
So
packer.
me and
Janet was the
our
unpacker.
niece, the other niece, Haley.
Right.
And so I'm unpacking like all the kitchen, the implements, like the things, pancake flipper and all that. And I started just piling up each thing because there were like 6 spatulas. And my favorite was there
Chip
were
clips,
30
chip clips, 20 chip
Oh, there were
clips.
like 100 chip clips. Wait. But 30 coffee scoops. And I said to her, okay, we got to narrow it down. You can keep 2. But, I go, why do you keep taking them? Because, I'm afraid Fresh Market's going to run out of them. I go, they're running out of them because you've got 30 of them.
Middle school librarian. She loves what she does and she's very good at it, but it ain't the real world, let me tell you right now. Yeah. But she does have a rescue pit bull, which every time I hear her, he's barking his head off. And I said, Penny, the HOA, the neighbors are not going to like that. I want people to know that he's here. I'm like, okay, you're going to get the letter.
Yeah, that's right.
She had to take the outdoor. She had like the lady before her had like those outdoor drapes that you kind of pull back on the around the patio. She had to take them down because Buddy was terrified of them.
Oh yeah, he's a little strange.
Because they blow.
We need to ask Rance what kind of. You have two chocolate labs?
Yes.
I love labs.
He does a lot of Ducks Unlimited and things like that.
Oh, are they hunters?
Yes. Yeah, they're both hunters. Well, one's retired.
I got a picture of the one with the Easter basket with the duckling in the basket.
Yeah.
Who is that?
I was gonna say, we were taking. Yeah, that was Cage. Yeah, we were taking a. They were taking a little bit of a chance with that duckling, I think, but that was okay. He was pretty. He was a good sport for it. Oh. No, actually, my old guy actually he turned 14 years old today.
Oh, did
he?
Yeah, he turned 14 years old today. So he had Chick-fil-A nuggets for birthday dinner today. So.
And which sauce did he select?
Yeah, he quite honestly, he's kind of a no sauce kind of guy. Yeah.
Okay, that's my husband. Mike doesn't like sauce either. The only person I know that puts lunch meat on bread and eats it. I'm like, don't you want some kind of thing on that? No.
Well, I have a story for this week. So we have a group text in our neighborhood. We live like in a double cul-de-sac. So everybody keeps an eye out for everybody. It's really nice. And I get this video of a cat with a big something in its mouth going like this.
Your
like
cat.
Oh, yeah. Oh. And the neighbor says, Kitty doing her job. And so I text back to the whole neighborhood. I said, that's our Isabel, who now works part-time for Orkin Pest Control.
Rance, is Cage in good health? Your 14-year-old?
That actually, Rue is my 14-year-old.
Oh,
Rue.
Yeah, Rue's my 14-year-old, and yeah, he had a bout of vestibular disease about 18 months ago, so he still got a little bit of a head tilt.
What's up with that? Honest to God.
So he's just kind of walks around like listing a little bit to the right.
Yeah.
But quite honestly, the last time I ran blood work on him, which was only about 6 months or so ago, it actually looked better than mine.
Yeah. I hear you.
Yeah, so I think there's a good chance you may outlive me.
Do you think do you think that's vascular? Because it's such an old dog thing.
What is that?
Oh. It's basically it's at least what we would maybe equate with it is kind of like getting a bad case of vertigo. Because at least that's what we see with these dogs. But they'll get a head tilt, they'll get abnormal eye movements, they'll get incoordinated. I mean, I actually was standing here whenever he had his attack, and he literally just flopped over on his side. I thought he was having a seizure. And then whenever I got over to him, I started seeing his eyes were going back and forth real quick and all this type of stuff, and he was trying to roll and all this type of business. I was like, well, at least I know what this is.
Did you medicate him or no?
I put him on meclizine for a few days.
Yeah.
The neurologist will tell you that meclizine won't hurt but it really doesn't help much beyond about 48 hours.
Dramamine, Janet. Dramamine.
Yeah. Yeah. Motion sickness drugs. Yeah. So.
My mother-in-law had horrible vertigo because she was mugged. She was
really?
mugged at Christmas time. They were stealing her purse and she got hit over the head. She used to have to hold on to the wall. walls in the hallway to walk. She finally, after several years, I don't know, grew out of it or it went away, but yeah, must be horrible.
So when I had it, they did the Epley maneuver on me.
Right. Yeah, and like I said, when I said vertigo, but what we see the dogs do is more. It looks like vertigo, and I'm sure that's what they're experiencing, but
Yeah.
it doesn't appear to be like vertigo, like what we
Oh,
what we see. It does, because it's so acute in onset. I mean, it does. I agree with you, Alice, and the fact that they have usually residual neurologic deficits of some time. I've got to believe it's got to be like really small vascular events or something.
And it's always older dogs, and it's so frightening. I mean, imagine, Janet, imagine, you not being in veterinary medicine and having, like Rance, the dog just flopped over and the eyes are going the nystagmus. I mean, it's frightening. I can see why people freak out. I really can.
Oh yeah. And so, and it seems like, some of them are so much worse than others. I mean, I can remember some of them that I saw during my internship and my residency that I really think you could have, if you had an unobstructed hallway, you could have sat there and they would have rolled for 50 to 60 yards, because they feel like the whole place is moving. But his was bad enough that he, I kept him sedated with some Valium and that type of stuff for a few days, and kept him on anti-motion sickness drugs. And within a few days, he was able to get around actually pretty well. And
was he eating? Did he lose his appetite?
He's a lab.
Yeah.
Whenever that happens,
there's a problem.
He's dead. And in fact, he's actually probably been dead for 2 to 3 days whenever he loses his appetite.
Isn't that the truth?
They're going to eat for several days after they're dead.
Because people will say, "Well, how do I know it's time?" And always tell them, and of course, as germ, we don't really have fatal diseases most often. But I'd always say, they love to eat. And what was your advice there, Rance, when people say, well, how will I know when it's time?
Yeah, I talk to people about that a lot, as you might imagine, and I call it the big four, eating, drinking, pooping, peeing. All four of those things are very important, but case in point, Labradors, if appetite's the only yardstick we use, we would probably never have a discussion about euthanasia, but I don't know that that's necessarily the only indicator of quality of life. What I tell people to do is that they know their pet a lot better than I do. And they know the things at home that indicate whether they're having a good day or they're not. And the example that I use is if somebody rang the doorbell, or if the mailman went down the street or whatever else, and do we care? That type of thing. If I rattle the back door here at the house, and I don't have two Labradors trying to run me over to get outside, either they've gone deaf or, which unfortunately that's the one thing that has happened to Rudy. I think he is pretty much deaf. I just have to wake him up, and then he runs to the door and runs out, But if you're starting to see those types of things happening, you're able to start checking boxes and say, was this a good day or a bad day? And everybody's going to have a bad day every now and then, but if we're starting to find that the bad ones are outnumbering the good ones, and there's not a lot we can do to make the bad ones better, well, then you've got a quality of life problem. And I think that's where you really probably need to be thinking about, when do we make decisions?
I'm just curious, what has your longest living lymphoma case lived out to be?
That's a good one. And quite honestly, it may be one of the dogs that, there was a Australian Shepherd that I treated, that I know went for like 7 to 8 years after completion of chemotherapy. Wow. And ended up dying of let me take that back. Actually, he developed a second malignancy that we treated, and then actually something else happened to the dog after that, and it died somewhere in its teens. I want to say that I started seeing it whenever it was like 2 or 3 years old, 3 years of age, and it died, as a teenager. I'm currently seeing a healer that the last dose of chemotherapy I gave that dog was close to 5 years ago. and it's still alive.
So how often are you
if you look
checking
at-
that dog? Like every 6 months? Or?
I see it about every 3 to 4.
Okay.
I see it about every 3 to 4 months. If you look at the papers that talk about long-term survivors with lymphoma, it appears that actual cures are probably about 5% of treated patients. I don't know if it's necessarily that high, but that's the number that gets bandied about. And I always tell my clients, I said, I've probably been lucky enough to have maybe more than my fair share of those dogs that probably were cures, but I absolutely refuse to call them a cure from their lymphoma unless they die of something else. Type of a thing, because I don't want to jinx them. But I definitely have got long-term survivors that defy
That's
explanation.
hopeful.
Otherwise, yeah, and it's like I say, I'd love to take credit for it. I think what it is I probably was just dealing with a really cooperative lymphoma. Kind of read what it's supposed to do and went into remission and stayed there. It's like it didn't get its invitation to come back. So
Yeah.
Well, Rance, we have a question for you.
Okay.
What is your favorite pet or human peeve? Peeve.
The old pet peeve. Quite honestly, we've already talked a little bit about it, and that is the absolute thing that drives me crazy is to hear I was told to just watch it.
Oh.
Agreed.
And I go, that may not be our best plan. I think it's absolutely fine to take observation as a therapy if you have a pretty good idea what you're dealing with. But if you don't know what you're dealing with, I think observation can get you in a lot of trouble. So that's probably one of my biggest pet peeves.
Who do we give credit for saying, watch it get malignant? That sounds like a Dr. Kodo saying or something.
Yeah, it sure could
True.
be.
This has just been so fantastic. I know there are a lot of my friends' dogs are, get cancer and they don't know what to do and they have so many questions. So this is just tremendously helpful.
I know.
Thank
When
you.
Janet's friends heard you were going to be on, they're like lining up to listen to it. So Duke, our producer, is like got to work on this one fast.
Exactly.
Hey, we want to thank Dr. Gamblin. I learned so much about cancer and the veterinary attitude toward it, how it's a different thought from human medicine, that we value quality of life. And it was great to hear the advances in the different kinds of cancers, which unfortunately our loving pets can get. And so until next time, I'm Dr. Alice Novotny-Jeroman.
And I'm Janet Novotny-King. We are the Novotny sisters from Cleveland, Ohio. Feed your pets, love your pets, extra treats from us, and don't forget to give them a big kiss and a hug. Thanks for listening.
Bye for now.
Bye.
Hey, thanks for watching.
And listening.
We like likes.
Don't forget to like, share, and subscribe. You can follow us on social media at Speaking of Pets.
And give your pets a big kiss from the Novotny sisters.
The Speaking of Pets podcast is an SLA video production.